The next step is to confirm placement to make sure it's in the right track. So in order to do that, we will use the extension set that came in the kit and the catheter tip syringe. So you want to make sure that the smaller feeding port is closed prior to checking placement. And then you will take the catheter tip syringe and insert into the larger feeding port. You will then connect your extension and give a gentle pullback on the plunger of the syringe. It should draw some stomach content or food that may be in the child's stomach into the extension to confirm that you have placed it in the correct spot. Once you have done that, you can remove your extension, close the flap of the G-tube, and wipe off any excess lubricating jelly.